Can we try doing this later?
No, just do it and be done.
But I didn't get all the way through it before we started.
You'll be fine.
Well, you could cheat. We could move after you cheat. Oh.
Don't say that. She's recording. We're just recording right now, you guys.
All right. My aunt almost died last Saturday. A couple of years ago, she had gastric bypass surgery for the purpose of weight loss. After experiencing odd symptoms for several weeks and remaining undiagnosed by her doctors, her duodenal ulcer, which her doctors were unaware of, perforated. This is commonly known as ruptured bowel. She had to be airflown to a hospital where she could receive a procedure to save her life. During her second surgery, they removed her stomach. Recovering from perforated duodenal ulcers after receiving gastric bypass surgery is a long and tenuous process. Post-operative complications must be dealt with swiftly, post-operative care must be attentive, and preventative medicines as well as the diet of the patient must be carefully monitored. The National Center for Health Statistics estimates that in 2016, 40% of adults were obese and another 32% were overweight. When patients exhaust all their options, sometimes they opt for gastric bypass surgery at the recommendation of their doctor. There are 4 types of bariatric surgeries. Roux-En-Y gastric bypass is the most common type. According to the research done by bariatric expert Dr. Sharma, the popularity of gastric bypass surgery has been decreasing because of the risks such as small bowel obstruction, internal hernia, and duodenal ulcers. The care of the patient in the weeks following the operation are imperative to the recovery and the health of the patient. Post-operative complications must be dealt with immediately. The mortality rate of a person who has experienced a perforated ulcer is as high as 20%. Patients must watch for symptoms that may indicate that their perforation has become septic. It is common for perforations to become septic when they are not caught and treated within 24 hours of the event. Based on the situation and the condition of the patient, some ulcers can fail to heal. Patients must strictly follow the diet and medications prescribed by their doctor to prevent sepsis. H. pylori, a bacterium specific to the stomach that causes infection, may be resistant to antibiotics. This stunts the regeneration of cells. Further information for H. pylori can be found in the U.S. National Library of Medications. Post-operative care is important to ensure the full recovery of a patient. Patients must take medications exactly as prescribed. Failure to do so may result in the patient becoming septic. Dr. Cahalan said spontaneous perforation can be related to inflammatory changes or tissues weakened by medications or connective tissue disorders. Patients must track their symptoms after being discharged from the hospital. Failure to report any irregularities or abnormalities to their doctor may result in sepsis. In the days following surgery, the medications change frequently. The patient will stay in the ICU for a few days following and will most likely need IV fluids. My aunt stayed in the hospital for 6 days. Until the stomach or perforation is healed, the patient must be careful about what foods and fluids they consume. Any deviations from the prescribed diet or medication will change the health and the healing process. Again, the patient may become septic. Patients should check with their doctor to see if they should avoid non-steroidal anti-inflammatory drugs and use acetaminophen instead. Aspirin and ibuprofen, 2 common NSAIDs, increase the likelihood of gastrointestinal ulcers and bleeds. For long-term recovery, it is recommended to get 7 to 9 hours of sleep, avoid stress, learn stress relief techniques, eat healthy foods, and exercise intentionally. The Mayo Clinic says botanicals recommended to treat peptic ulcers are turmeric, mastic, cabbage, DGL, and neem bark extract. The patient's diet is resumed in stages. In summary, there are many risks and challenges to recovering from perforated duodenal ulcer following Roux-En-Y gastric bypass surgery. Patients must remain alert and informed in all aspects of their recovery. Any complications will lead to an immediate change in health or may possibly result in death. To ensure the safety of persons recovering from ruptured bowel, postoperative complications must be dealt with swiftly, postoperative care must be attentive, and the diet of the patient as well as medications prescribed must be carefully monitored. The doctor said as long as my aunt follows her recovery plan as prescribed, she should make a full recovery. Mom, that was so bad.
It was great.